There's a new COVID variant, and it's called FLiRT.
Yeah, DC News Now's anchor Chris Flanagan spoke with Dr. Glenn Wortman, the chief of infectious diseases at MedStar Washington Hospital, about what we should expect in the next few weeks. Their conversation is in What's Going Around.
Yeah, the symptoms look to be very similar to past variants. It's going to be an upper respiratory tract infection, pretty much the same severity thus far as we've seen with the other COVID variants as well, which is fortunate.
Is there any concern about this new FLiRT variant, Dr. Wortman?
You know, there have been so the numbers of the FLiRT variants have gone up. We're seeing more than we were earlier in the spring. But fortunately, the severity, as far as people coming into the hospital or people dying, that's remained very low. So people are keeping an eye on it. But thus far, it does not look like it's going to result in more severe disease than in the past.
Dr. Wortman, do the current vaccines work well against this FLiRT variant?
So that's still being studied, but preliminarily, it looks like the vaccines will provide some cross protection with the FLiRT variants.
Dr. Wortman, I know in past summers, sometimes we've seen a surge in COVID. Do you anticipate, from what you're seeing now, another summer surge with COVID?
I hope not. I hope not. It's always hard to predict, but summertime, people are out and about, they're with each other. So we may see a bump, but hopefully it'll be just a little bump and nothing too severe.
Dr. Wortman, how might this new COVID variant FLiRT impact the COVID vaccine formula that will be updated this fall?
Yes, I'm not directly involved in vaccine development, but from what I'm reading, the WHO and the CDC are looking at the FLiRT variants and trying to plan the vaccine for the fall. So I think it's going to impact their planning because you want to have a vaccine which covers what's currently circulating in the community.